So this is Karen. Karen, just say hi.
Hi.
So Karen's been doing functional medicine in her office, and I'm just going to ask Karen a couple questions because I'm sure there's a lot of people out there that are suffering. In fact, I know there are a lot of people out there suffering that need some help on a functional medicine basis, which is what I practice. So, Karen, what did you initially come in for? What kind of condition?
I came in because I knew I was having an issue with my thyroid. I'd already been to see a general practitioner and they had diagnosed me with a hyperthyroid and they wanted to radiate it, and I didn't think that was a good issue. So when we saw that you were having a seminar, my mom saw it in the paper and went to it because all the issues that I was dealing with were listed on there, and so I came to talk
And there
to
you
her,
were.
and there I was.
Okay, so just so the audience knows, so you're having a hyperthyroid condition, which is called Graves' disease.
Okay.
Okay,
Yes.
so the condition that she was diagnosed with, which is Graves' disease, which is exact opposite of hypothyroid. So she had a problem where her thyroid was working actually too much, and that's not a good thing either. And the next step for you was to have it radiated, like radiation. So, so did they give you some like instructions on what that looks like? Did they tell you?
No, I had talked to other people or who'd heard from other people who had had their thyroid radiated.
Okay.
So, and it didn't seem like an option for me. That would have been the very last direction I would have gone.
Yeah, totally. So she's been coming to see me for I think about 8 months now, or maybe even like a year. Oh, been a year. Okay. So in the past year, what's happened with your thyroid? Do you still have your thyroid?
I still have my thyroid. Yes.
Yes. So she still has her thyroid, an organ that God put in her body, and they wanted to give her radiation to get rid of her thyroid. She still has her thyroid through functional medicine.
Amen.
So yeah, amen. So that's pretty awesome. And then a couple bonus things, like, keep your thyroid first. Bonus would be your hot flashes are better.
My hot flashes are
Okay.
better. I dropped 4 sizes.
You don't get on the scale.
No, I didn't
No.
get on the scale at all, but I did go from, I was almost on the verge of going into 18s, and I can fit into size 10s now, so.
Well, 18s and size 10. So you were size 18 to size 10.
On the verge of
On
going,
the verge of going
into
to 18.
18s,
Okay, so
yes.
that's a lot of weight, right?
Yeah, that was a lot of weight.
Right.
So I didn't step on the scale, it was just all how the clothes fit. So when I could get in, that was a bonus, so.
Yeah, totally. And then you said that your memory is better.
My memory is better as well, yes. And I don't have the brain fog that I was dealing with either. So, of course, my energy level is back to where it used to be. I feel I can go out and do stuff. I'm not stuck on the sofa wondering if I'm even going to make it upstairs to go to bed or not.
All things that everyone should be able to do.
Yes.
Yeah, totally. Yeah. And one last thing when we left the room that which I thought was interesting, is you went to see some other practitioners for this, right?
Yes, I was going to another general practitioner that was supposed to be natural or incorporate natural methods.
Some
as
functional
well.
medicine stuff.
So yes, but they kept pushing the progesterone on me and just, oh, you're not getting enough. You need more of this. Even though I had expressed some other concerns to them as to how he was feeling and whatnot too, with even just how my throat was feeling.
Yeah,
so.
right. So you got no results with that?
No, I didn't
None,
get any
none,
results
none.
with that.
Yeah, okay, cool. So if someone if someone has apprehension about doing some functional medicine, what would you say to guys and gals right now? Because someone's gonna be watching you eventually, Karen, and they're gonna be like, "Wow, this sounds like me." What would you say to people that have some apprehension about just doing some functional medicine or something outside the box?
I would say that you're better off approaching natural medicine because it's natural and it's going to be things that are going to be good for your body, not man-made products with chemicals and whatnot that only cause more problems down the road. So I know that was one of the reasons is I didn't want to be on drugs the rest of my life either for something. So there's been so many benefits to just doing it through functional medicine and approaching the diet and whatnot. Challenging at first, but you overcome it and you learn good things from it that are going to benefit you long term down the road.
Yeah, and one thing, so diet's definitely a part of it, Then also throughout basically the year program, we put you on very specific supplements.
Yes, there were
right?
supplements, yes.
And just so people know out there, those supplements are very specific, very specific based on what Karen needed.
Yes.
Right? So these supplements are more powerful than any drug because used in the supplement used for the right condition at the right time in the right dose is more powerful than a drug. And that's why Karen actually basically got her life back with some functional medicine, and it's outside the box. So if you're suffering, you need some help, the good news is that you can get help and you don't need to continue to suffer. You just need to do something a little different. You always got to take a little leap of faith whenever you do something different. Karen did that, and what's your thyroid worth? Like, what's a gland worth? I mean, you can't even put a dollar price on organ function and just the way you feel. So anyway, I hope you found value in this, and I hope you found something that you can relate with Karen. So take care, and any last thoughts, Karen?
Well, give them a call. It's worth your time.
And get some help.
Get some help. Amen.
Amen. Thank you.